Okay. So we are now live. I'm just going to read our script for our remote meeting. So the time is, it's 2:36. Today's date is November 17th, and we are holding a meeting of the Greater Boroughs Advisory Board. This open meeting of the Greater Boroughs Partnership for Health Advisory Board is being conducted remotely, consistent with Governor Baker's executive order of June 16th, 2021, an act relative to extending certain COVID-19 measures adopted during the state of emergency. All members of the Greater Boroughs Partnership for Health Advisory Board are allowed and encouraged to participate remotely. The orders allows the board to meet entirely remotely so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. The public is encouraged to follow along using the posted agenda unless the chair notes otherwise. Members of the public who wish to view the live stream of this meeting may do so by going to Northborough Remote Meetings on YouTube via the link listed on the agenda. Ensuring public access does not ensure public participation unless such participation is required by law. This meeting will not feature public comment. So I'm going to go through as the chair. I'm going to confirm the board members, you're here, you're present. So when I call your name, just please respond in the affirmative. So Heather Alker.
Present.
Chief Flanagan.
Here.
And Jennifer Sullivan.
Here.
And we also have Katie Holt, Administrative Assistant, the town of Northborough on with the Health Department. So thank you, Katie. I just want to provide a quick update and a big welcome to Chief Flanagan. So whether an update, Sarah stepped down as the Boylston's primary voting member on the advisory board and held a Board of Health meeting and appointed Chief Joe Flanagan to that position, and he graciously accepted. So we welcome you, and I understand that you're now the primary voting member for Boroughs. For Boylston.
Sure. Whatever you tell me, I don't really know. So yeah, that'd be great.
Okay, awesome. So welcome, Chief. We're really excited to have you. And Jen, I don't know if you realize Heather's worked with Chief Flanagan for a while. Chief Flanagan wears a lot of hats in Boylston, and he does COVID testing and clinics, and he knows it all. So he's really a colleague in the field of public health. So thank you for joining.
Thank you.
You're very welcome.
So we'll jump in. I just want to point out to all of you, there were some attachments to our Outlook invite. And so if you're looking for those items, you can find them in your Outlook invite. I'm just going to share my screen so we can peek at the agenda and just try to quickly move through it. Jen, what's your hard stop time? I know you said you had another obligation. Oh, you're muted.
3:15.
Okay, we can make this happen. So we'll move
All right.
quickly, hopefully. And I don't want people to feel rushed. And again, why we pulled this together, our next regularly quarterly meeting was scheduled December, and December 8th. So that meeting's still on the books, but we're holding this just so we can make a decision to move forward with the contact tracing grant. So I will share this screen with all of you. And I think it would just help us hopefully. Let's see. Can you guys see that okay? Okay, so I just want to go over the agenda quickly. Oh, I'm getting these warnings. Okay, does that look okay for you guys? It's prompting me. All right, so we're going to cover quickly contact tracing, our existing contracted nursing services with Sam, and we'll then most importantly get into our updates about this new grant award. We're going to briefly cover, a discussion of some remaining funds in fiscal year 22. We'll talk about some other funding opportunities. We'll fly through. I just want to apologize to everyone. The draft meeting minutes were included. Thank you very much to Katie Holt for pulling those together. I forgot to include a line item for those in the agenda, so we won't be able to vote on those today, but we'll vote on them next week. So you have a copy of the draft if anybody needs those. So just here looking at the contract nursing services, just a quick update. We're very excited to welcome our new part-time public health nurse under that original contract with Sam and VNA. His name is Jim Frederick. He's a registered nurse. He's been a longtime Hopkinton Fire Department employee over there and has done a lot of help to them with some of their public health services as well, and we're really excited to get him on board. He officially signed his contract on November 8th, and I did confirm with Ann Labonte and Salmon VNA just before this call that his official first day in the office over in Westboro, I believe, is going to be on 11/22. So Salmon has an onboarding process that he did complete all the required paperwork over the last few weeks. So Jen, sorry for the delay in getting that going. I think he's going to be a really welcome addition to Westboro and exactly what we need with the CTC disappearing. So just another quick point on support of the COVID-19 vaccination clinics. I know because of the delay, I know Salmon has sent a few nurses over to Westboro because you've been short to help with your clinics. And that's something that you can work directly with Ann Labonte. For the most part, for like Southborough, Northborough, Boylston, if they're bringing in additional staff for clinics, and you're a little different, Jen, because you've been, shortchanged for a few months. But for the other towns, if you want to work with them in VNA, they did provide us an hourly rate. And we can work that out directly. So I think you're aware of that, Heather. And so that's something to consider moving forward, but it's really based on their availability, right? Our 1.5, like Erin has a set 40-hour-week schedule. Jim will have a set schedule that would be dedicated to grant, but those other Salmon VNA nurses that are available through Ann, it really is subject to their availability. But just know moving forward, we can work that out. So something to keep in mind, Jen, whatever you and Ann have going is sort of different. So keep that going, whatever you need. And then COVID-19 testing, I just wanted to bring your attention. So we do have that PCR machine. I believe all 3 towns, there might be one outstanding invoice for the PCR kits, and I'll talk to you guys offline, but that machine is up and running. So remind your, town offices that if you have a municipal employee or schools that really needs to get tested, Erin is here in Northborough. I'm trained, Diane is trained. We can help to administer those rapid PCR tests. We don't have the bandwidth to run it all day and open it to the general public, unfortunately, but we're there. We also did just receive in Northborough an additional 160 Binax now. I don't know where, Chief, you were on your supplies or Southborough, but we have a bit of a surplus here. And so whatever needs to be done to support the region, that's something we are happy to offer. And so one thing that we use the nurses in Northborough and, I want you to make aware of is we had a town department where we had a positive case, and it was an important essential department, and we were worried about exposure. There were close contacts identified. So we did go in with the Binax now and just test everybody in that department using that nursing staff. So it's just something to think about if you need that support. It's a call away and we can figure out that if needed. And then flu clinic planning. For fiscal year 23, which I know you're like, really, we're trying to fly through this. Why do we need to do it? Salmon puts their order in crazy early. Like that's how I don't know the world of flu vaccine ordering, but apparently they have to put it in so early. And so I know only some of the towns use them for their clinics this fall. And it was, we were limited in vaccine because by the time we signed the contract, they had long put in their order. So we couldn't come up with vaccine. But for next year, they can pre-order it. So under our contract with Salmon VNA, each town is eligible for up to 2 clinics. Northborough's had a history of always doing one at the schools and one at our senior center. And so that is open to you. Obviously, we're in our current contract. We're anticipating our Salmon contract will look the same for fiscal year 23. So I just need you guys to think about it. If you're going to run your own flu clinics or not run flu clinic, whatever you want to do is fine. But try to get a number to me or to Ann in the next week that says, like, for example, we did a large drive-through clinic. We invited Southborough as well. I think we did almost 400 or well over 300 shots that drive-through clinic day. We're going to gear that up more because it was so successful and probably order at least 500 doses or maybe 6. Because we did have the capacity. We used both Salmon nurses that were under the contract because they provide that because it was such a big clinic. We did pull in volunteers.
I was approaching 500, but I don't remember.
Yeah.
It just went so smoothly. It was hard to tell.
Yeah, we could have done 603 hours easily. So we're going to look to do that again. So that's sort of the number I'm giving to Salmon. Like we did 100 at our senior center. We did 100 at the drive-through, really talk to your community. We'll be able to get way ahead of this and give me a count of what you want them to order, right? I think they have the ability to say, actually, we didn't need that many, they could turn some back in June, but we need to get that order in now. So think about it, talk to your board, talk to your town departments and let Salmon know in the next week. Any questions on any of the contract nursing there? Okay. So here's the big excitement, time sensitive, let's get going. So DPH did the second round of the contact tracing grant. And this grant is specific to local health support for COVID-19 case investigation and contact tracing. So again, that we received the official notification of the award amount on November 8th. They did reduce our original request. I went like pie in the sky. We wanted I asked for 2.5 full-time equivalent, and they came back and they didn't give us 345,000 a year, but they gave us 160 a year. This is like tied to federal funding. I'm told that the money is rock solid. It's sitting in a bank account already with the state. And so this is for both fiscal year and fiscal year 22 and 23, 160,000 each year. So at a minimum, we have to have a part-time epi. I spoke to Kevin Cranston, who's overseeing this, and that's a requirement. So in your Outlook meeting invite that we sent out last week, or maybe Monday, I'm sorry, there is the revised budget is in there. All the line items from that budget are also on this slide. So we reduced to meet the 160 on the dot. We reduced the contracted nursing services to 90,000 to contract through a nursing service. If we went in-house with a full-time nurse and had municipal benefits, we'd be way over that amount. So the thought in the contract nursing is, one, we can move quickly. There's probably some cost savings to it. And we just really need to get somebody in place. And this isn't a long-term funding, it's a year and a half. So I have 900,000 on that line item. There will be an additional balance for fiscal year 22 because we're not starting it until now, right? So there's going to be money, but we need to balance a budget that will continue to work in fiscal year 23. So there will be a surplus that we're going to see. That will need to be applied to buy equipment, like if they need a desk, if we need a computer, but those items would be like less than $5,000, right? Like it wouldn't be a big number. And then there is going to be a chunk of change left. One thought is we could also apply that funding, the surplus, to additional per diem hours, either through salmon or some other mechanism. But we would have to vote that in a group. I don't think we have all those pieces in play, but maybe we'll know more by next meeting. So that's a consideration that there is going to be that additional balance, but it's all going to be about contact tracing, right? And once we're done contact tracing, these staff positions can do other things that are related to public health. So something to keep in mind. I put in the revised budget an amount of $32,300 for a 19-hour week epidemiologist to be hired by Northborough. I'm doing 19 because we just, again, don't have the money for benefits. It's not going to be a permanent town position. We'd be able to hire this in-house. I just threw in a number of $35 an hour because that's what I'm hearing other towns like Hudson that are hiring. It's within that range. I'm hopeful that we'll find somebody. If we don't, or we need to up it, we're just going to have to come back to the drawing board and make this budget work. All of you should have received a copy in the Outlook invite of the epidemiologist job description that Rebecca Meekins here in Northborough, she's the assistant town administrator, drafted. I think she did a nice job with it. If you have edits, we'll talk about that a little later. But my goal would be to have this meeting and for agreement to post immediately and look to hire that. And then there's a line item in that budget for $7,700, which is the shared service coordinator, which is really me. I can't be paid, that, but what we've done is in Northborough, we backfilled some of my work. So we're taking some things off my plate with other staff. And so that's really why that's in the grant. And that was also in the other grant, and the same line item at the 15% administrative support line, which is pretty standards for grants. And that's to cover the town of Northborough for all of the GIS, MIS technology, accounting, and all the rest. So that's the same standard line item. So if you add all those numbers together, they equal exactly 160. So any discussion on this revised budget?
You did a great job.
I hope it all works out. We can put these numbers, but we all know in public health, you can't hire right now. So there's a lot of finger crossing right now.
Right. I did have concern about finding an epidemiologist right now with the workforce that we have. And the job description looked great. Maybe take off the emergency preparedness just because there's too many things potentially on that for a year-long position.
Sorry.
Go ahead.
No, that's okay. I'll let you finish.
Go ahead, Heather. I think you have the floor.
Oh, okay.
Jen said you had the floor.
That was it on the epidemiologist posting. I didn't know if we were going to talk about the nurse and about if we were going to talk about the email you had sent a few weeks ago about the FTE for the nurse and splitting that either four-way or with a per capita, and when we're going to come to a decision on that.
So I think it's tough. I mean, this is conceptual at this point, right? We got to get the people in play. I think, in talking with DPH as we've been doing, the quarterly reports and the planning, I think we have to think about equity, and we have to think about equity per capita. And
Absolutely.
so, and I think what I would, there's no perfect, easy way to do this, right? Sharing is hard. It's just like I tell my kids every day. I think what we're looking to do is, for Southborough, because you have more staffing, is that the nursing brought under this is for surge capacity. So none of this
that was
for
in the per
anybody.
capita, right?
Yeah,
right.
none of this for anybody is set office hours. This is sort of, well, we just need to get something in play ASAP because CTC is gone in a week? I don't know. Where are we? 2 weeks? And and I think that's something where this board will meet to discuss.
Right, and our town is looking at that for our budget season. So I don't know if we vote on that or put that in writing at some point.
Yeah, I think that's something we could hopefully we'll have a better idea on, maybe numbers at our next meeting, and then we could do an official vote over like sort of the management or where they sit. I know we have space here in Northborough, but we might only get candidates that want to work remotely. And to tell you the truth, I just want the right candidates in place right away. I do think with adding more nursing staff, there will have to be like a weekly check-in. There will have to be a system in play where all of these nurses and the epidemiologists get together and they have a system for assigning cases. I think for keeping things simple, I like the idea of having one point person in every town. So Westboro has Jim Frederick. Northborough has Erin. Boylston's sort of got Erin right now and floating. I would like to consider putting the new position as the main lead for Boylston, just so it's like everybody has one lead, and then they'll have to do like a weekly check-in. And with Ann and Sam and VNA and their management, they're going to have to find out a system for sharing workloads as they flux, right? Like there's going to, I think we realize all these nurses are supporting our towns, and getting through the holidays may be difficult on the contact tree. I mean, we're feeling that right now in Northborough.
Yep.
We're drowning today.
Yep.
It's really, really bad.
We've
On the
been
number,
drowning.
I think we have like 7 or 8 cases that came in today. So it's just
Not today, but yeah.
We're just going to have to figure it out. So I think we will look at like a per capita, and these new contact tracing staff aren't going to, I think we'll have space for them if they want a location, an office location or a way to connect. But
and
I would,
this quote year and a half covers sort of when does it start and when is that year and a half?
so the year and a
Starts in
half,
January?
according to the state, it's a fiscal calendar. So it's fiscal
Right.
year 22-23. So it hard end date for these positions are June 30th, 2023.
Okay.
What the contract would look like.
And it starts anytime, or January?
As soon as we can get someone. Yeah, I would say ASAP if we could get them started tomorrow. Part of the reason on that next sort of bullet item is I'd like to, entertain a vote to contract nursing services with BNA, Sam and BNA. We don't have to go out to bid for nursing services because that's, an exemption, for nursing. And it could be more a simple addendum where the town of Northborough would execute an addendum for these additional services, whether or not it's a fiscal year 22 or it would probably be like a fiscal year because the town typically doesn't cross fiscal years until we receive the funding. So we would probably execute a contract with them through the end of fiscal year 22, renewable. And again, that will be reviewed with this advisory board. So, so I would say they could sit here if they needed to sit here in Northborough with spacing either downstairs or on the second floor down the hall. We would use some of that surplus money just to buy just basic equipment, make sure they had a laptop. Typically the way it's worked with Salmon, for example, when we contracted, they got a cell phone through Salmon. I don't know what we'll do for the EPI or if there'll be an office phone or any of those details. So to be determined, but I guess for us to proceed forward, one, we don't get the money until the town of Northborough signs the contract and sends it back to the state. That is due on November 18th. So that's tomorrow. Okay. It's all quick, right? We get it on the 8th and we have to have it back. And that's why we needed this meeting. Our town was not going to sign a contract with the state if we weren't all in agreement to move forward. And so I think what we're looking for that, yes, does the advisory board want to accept the grant from the Department of Public Health with, Northborough as the host. And so
I move to accept the grant with Northrow being the host town.
I'll second that.
Okay, so we have a motion and a second. Any discussion? Okay, we'll do a vote, roll call.
Jen, yes.
Joe, yes.
Heather, yes.
And Kristen, yes. Okay, great. Jen, I love how you move things around quickly. So I guess the other questions then too, and I just have them up on the screen, and whether or not we'll do a vote to contract with Sam and VNA. And and to be completely honest, I know it's been a little bit of a rocky start with, especially with Westboro's experience in terms of the staffing not coming through. I think, we had somebody selected and it just was a perfect storm. And I think all boards of health are having the perfect storm of nursing. I just spoke to Natick. And on another topic, do you have a public health nurse? We're hiring, everyone's hiring. So I know there's a real shortage. So I do want to be creative on filling the nursing position. I'm also open to 2 part-time. My ideal would be 1 full-time because it's 1 person, less hands in the pot, communication's easier. But if we can't find 1, I would be open to 2 part-time. And I would be open to LPN, maybe not at the full 90. Like, we just need somebody who is a good communicator and who can do, it's a contact tracing grant. And then if we fill it, there's other things we can do. We have 2 RNs in the region. So if we run vaccination clinics or anything, that LPN can still do a lot. So I'm pretty open. We do have a candidate we know of in Boylston, who may be a really perfect fit, who's an RN. So we have a few feelers out there. We're open to any feelers you have. If we want to move forward with Salmon, we can send them their way and they're ready to start interviews as early as like beginning of next week. So I guess I don't know if I'd entertain a motion to contract the nursing services, the grant through Salmon DNA.
I second the motion.
Okay. And then any discussion on the motion to contract nursing nursing services for this new contact tracing grant through Salmon DNA? Okay, so we'll vote, roll call. Kristen Black, yes.
Joe Flanagan, yes.
Jen Sullivan, yes.
Heather Alker, yes.
Okay, great. And then thank you, everyone. That was unanimous. I'll just stop this share so you guys can all see screens. Are your screens normal? Mine's a little funny. We're all good?
Good.
Okay, so I guess the last question then is whether or not, are you guys okay with the epidemiologist job description? And then we would just need a vote, to accept, or we can make that revision, Heather, to remove emergency preparedness. If we meet all of our contact tracing, it does have other duties as assigned. So I don't think that's a problem. I want to be as flexible in that job description as possible. For me personally, I really want someone who can do data visualization, right? Like dashboard. I want someone who can grab all of our Maven data and just say, all right, for our 4 towns, how many were breakthrough? How many were breakthrough midterm? Whatever those things everyone's asking you for, right? Like how many ages 5 to 11? This individual could have like a schedule where they pull the data on Monday, they run it, they can filter by town and just give everybody that same slide to put online, or we do a main web, like wherever we want to go with it. That's sort of where I see this person. So there's no test to be an epi. So I just want to be clear. I think, as you can see from the job description, there's some preferences, but it's left pretty open on the qualifications. The state said with an epi, it could be someone who's worked for the CTC. This job description will go there. It could be somebody who's just graduated and took a class in epidemiology. It could be somebody who's worked in public health. It might be an RN who has that experience. So it's pretty broad. And I am hearing other communities have good candidates. So I'm
I have
hopeful.
heard that as well.
Yeah, which is great.
Crazy to me.
It's surprising. It's great. So we'd be looking to get this out right away. So I guess whether or not we want to do, I guess we just need official vote, to move forward with the part-time epi hired through Northborough and the job description,
I vote to accept the epidemiologist job description as written.
Okay.
Second.
And any discussion? Okay, and then roll call. Kristen Black, yes?
Jen Sullivan, yes.
Heather Alker, yes.
Joe Flanagan, yes.
Okay, great. So that motion passes. So I guess the next, thank you for moving through that so quickly, everybody. The next question is just, I just want to put on everyone's radar. We don't need to get into these details because Jen, you have 15 minutes and we all have a lot to do. We are going to have some remaining funds in fiscal year 22 under the Public Health Excellence Grant. And the reason for this is it took us, we lost a whole month with Sam and VNA because they didn't officially start, right? So we budgeted them. So they weren't, we prorated their contract. And so the nursing services line item wasn't expended in the month of July. And so that's at least $10,000. And
I have a question.
yeah.
So since you really haven't been paying for Westboro, shouldn't there be more money in that line item?
The way it was it's a contract with a monthly rate. So we executed the contract and they did have some nursing staff. So I guess the question is if they're offering services and we didn't take they don't bill per diem. They don't bill per person. It's a contract. And so that was executed on August 1st. They did have staff in place and then that staff left, in your case, Jen, for Westboro, and they have offered other staff to backfill, but the contract sort of was the contract, you know what I mean? And they're filling it. So we wouldn't be regaining more. I totally get what you're saying. It's sort of like where we are now with it.
Okay.
So, but we do have at least 10,000 that was never contracted, right? Because we started a month. And so I'll be going for a more thorough review of the budget that I'll be presenting on July 8th with the work plan. So I just wanted to touch upon that and see if you guys, the one creative solution I had with the 10,000, because now we have more nursing, is this group called BME Strategies, and that was attached to your agenda. Brian is, I believe, the owner, and he provided us this, or sorry, he's the executive director, and he provided us a proposal that he will discuss in more detail, provided you guys are interested. And I just wanted to talk through that to see if you guys were interested in asking Brian to come back. So within that 10,000 or even less, and his company has worked with other local boards of health on public health accreditation. And I think that's always been sort of a long-term goal for Northborough. It's a really difficult goal to achieve for small health departments like ours, but the process of planning and considering it, I think we could learn a lot. And he's done that in 4 other communities. And this proposal that you see about sort of what they do and who they are, this isn't a financial proposal, right? This is just sort of a summary. And so I'd really like you guys to look at that. And I just wanted to get a feel from the group. We don't need a formal vote as to whether or not you'd want me to invite Brian back for our December 8th meeting. To sort of discuss in more detail, like what we could do with some remaining funds as to whether or not we would want to, Northborough would execute a contract with them to work with us on public health accreditation and what that would look like. You know, so we'd have up until June 30th to contract, but we'd have to do the work then, right? Like we can't carry to another fiscal year. So I'm just curious if you guys are interested and think that's a good use. And otherwise we could brainstorm other uses too, if we have a balance.
I mean, I agree that the accreditation would be interesting to look into. So it'd be sort of for the 4 towns or kind of greater boroughs. I mean, we're still, we're not a joined health
Right.
district. So it'd be potentially each town looking into this. But as you said, it's a multi-year process, and but it would be interesting to at least explore and get some information about it.
And one thought is whether or not BME could sort of help our department seek funding to really get more formal in the process. Because we're not an official region, it would be individually, right? Like some of our staff may be shared, right? They might sort of look at the public health nursing we're sharing in that accreditation process, but it would be an individual part. Much of what they would have to do would be very individual, present, what I said personally, I would like from Brian's group would to come in and talk to my board of health about what is accreditation and what are the standards and what's attainable, right? What would be what's the low hanging fruit that we could work towards? Or, it also I think it could be helpful with our planning for our health departments and, what are our achievable goals, and that will help lay out our, 2-year, 5-year, 10-year plan, and where we go with it. So. All right. So I guess.
Yeah, I
with
think
that-
that's interesting. Yeah.
Okay. No, we have, Chelsea's just joining. We can give her a minute and say hi.
Hi, Chelsea.
Hi, everyone. Sorry I'm late.
All right. No worries. So Chelsea, we sort of flew through things really quickly. So just to get
Great.
you quickly up to speed, we did unanimous votes across the board. We've voted to move forward with the town of Northborough executing the contact tracing grant with the Department of Public Health. We have voted to approve the revised budget. Katie, did we officially vote that? I think, was that one of them? Okay, did we vote there? Did we vote to approve the revised budget?
No,
No, we voted for the town of Northborough to move forward, but it didn't specifically specify with the revised budget.
I move to accept the revised budget
Second,
that's been
I
created.
just actually had one question on the budget.
Yeah,
If you just give me a sec, sorry, I'm just
Sure.
we out of another meeting and I just looked at it earlier. On the, I think it was $7,700.
so,
What was that for?
so that was similar to the original town of Northborough Public Health Excellence. So part of my salary was in there. And what we've done in Northborough is Diane was actually brought in at 32 hours with the increase of the grant. So Northborough is actually paying Diane up to 40 now with that backfilling my position to do those other duties because she's helping with my septic because I'm
Okay.
taking on that. And so similar, I literally took that number as low as I could go. So it's at 0.08 full-time equivalent. That's why there was that weird point. So it's like whatever my salary, 0.08. And so the idea is that gives the town a small line item that lets
Got it.
take a few things off my plate. So that it's a
Yeah.
little more manageable. So that sort of mirrored, and I took that as low as I could go just to have that round 90 number on nursing, that $35 an hour. And I
Yeah.
think if we come back with either of those not working for staffing, I mean, there's just a
Right.
little bit of wiggle room there, but that's where that
Okay.
number comes from.
Okay,
Yeah.
Right.
So, great
I was good
question.
with it. Thank you.
You're welcome. Yeah, we did cover that briefly. And then, the 15% is the same standard administrative fee that was on there. We're looking at the EPI at, what is it? 3,200 or so. We're looking at around 9,000 to contract with Sam and VNA, depending on the individual. Our ideal is to go with one full-time. But if the numbers don't work or the candidates don't work, it would be 2 part-time. So we want to get as close to 1 full-time equivalent. So
Great.
any other questions on that, Chelsea?
No, that was it. Thank you. I think that's
Okay.
good.
So if there's no further discussion, I guess we should finish the official roll call vote for approval of the revised budget.
Jen, yes.
Heather Ocker, yes.
Joe Flanagan, yes.
And Kristen Black, yes. Okay. All right, great. So yeah, so let's see, we did cover the vote. So just Chelsea real quick. So we voted to approve the revised budget just now. We voted to contract nursing services with Sam and VNA through this fiscal year. We voted to approve the epidemiologist job description and, and Northborough will be posting. So we'll look to do all those things as quick as possible. I'm hoping to post the epidemiologist job description this week in Northborough. So it will be posted locally. We'll circulate it to all of you. It will go to APHVC. I'll send it out to MHOA. We'll spread it as wide as we can, and please circulate to any contacts you have. So even if you know somebody, there's a lot of wiggle room on those credentials. It's about the right person who I think is really good with data and good with communication and working spreadsheets and numbers, and also supporting the contact tracing and calling. It is contact tracing as well, and working with the state, as needed. But they're going to have to coordinate that with the nursing. And then keep flying around. We just, we're finishing a discussion here, Chelsea, when you jumped on about remaining fiscal year 22 funds. We may have up to, 10,000. I'll have the final number in fiscal year 22. And we're considering contracting with BME, or at least entertaining a proposal from them about assisting our individual health departments and sort of as a region with looking at public health accreditation, which is a very long process. But this would be sort of baby steps and even helping us understand if there's other grants that we could leverage to sort of proceed forward with that. And I think that's sort of the gold standard in public health, but small departments like ours really never get there. And so I think I don't want to see any funds turned back to the state at end of fiscal year 22 if there's still good work to do. Okay, so are we all in agreement then? Just a quick, I will invite BME back. Brian will present. I'll give him a chunk of time, probably right at the beginning of the meeting, so he doesn't have to hear everything else, and we'll get him in and out, and he could come to us with that proposal. And I could try to run the numbers better and maybe get a few more details from him about what he would really provide and what that would look like. But I would like to see a presentation to each individual Board of Health to talk with them about that process. So rather than making everybody come together, join those Boards of Health meetings and talk about this. So does that sound good to everybody? Okay. And just additional, I'm just going through the agenda items here. We also additional funding opportunities, enrollment in FDA retail standards and related grants. With the timeline and some issues with the portal, I know many of us were not able to get in those FDA grants. I know Diane here is probably going to be looking into doing the self-assessment. You don't need the grant to do it, but that's as time allows. So when she's caught up on her inspections, which would probably be at the end of the winter, if she has some downtimes, that's something she can work through, and that would make us eligible for other FDA grants. That is an annual grant. It renews every fall. So if we all missed the mark this year, that's okay. We could do it again.
I did it.
Yeah. Oh, you got it in? Okay,
I did
great.
too.
Okay. So yeah, we'll see where that goes. And then any other questions or anyone, any other grant opportunities or anything like that you'd like to discuss that you know about or we should bring up for next month's meeting? Okay. And just to clarify on the FDA grants, did you guys enroll or did you actually apply for like the $5,000?
I applied.
I applied for a BME, basically a company
Okay.
like his to come in. I
Okay.
didn't know we were going to use the 10 grand towards it.
Okay. So, and that would be specific to food and obviously the accreditation process. I would probably be more excited maybe because we finally have more nursing to maybe focus on some of the other accreditation specific to nursing while we have that staffing. So anyway, that for Northborough, but we could do anything with that. So, okay. And then just moving along the agenda, just to confirm our future meeting dates are, standard scheduled quarterly. Our next meeting is December 8th at 2 p.m. You should all have that in your Outlook. Actually, Chief Flanagan, you don't because you're new. And so, and Chelsea, just to update you, Chief Flanagan is replacing the voting member, Sarah, and Chief is going to be serving in this role. So we're excited to have him. So we'll extend those Outlook invites to you. Chief will update that. And yeah, so we'll next see
Okay.
December 8th and keep it on your calendars for March 9th and June 8th.
And just an FYI, I have another clinic that night, so
Okay.
I will be available as much as I can.
Okay, sounds good. All right, and then I guess, is there any other questions or discussion? Any other issues you guys wanted to bring up?
Just thanks for all your work. It's a lot, I know.
It'll be worth it. I think I'm like, at times I'm like, did we really do this grant? But I see Erin drowning and I fear, Jen, what's coming around the corner with you guys in CTC, and we'll just all have to figure it out. I just want to remind everybody with the clinics, we're all here to support each other. There's great resources where one update that's important for this group is much of my week was spent trying to get to the bottom of medical insurance reimbursements for all of our regional clinics and others. As you guys may be aware, between all of our clinics in Northborough and the regional, which was nearly 7,000, we've administered nearly 20,000 doses, and they've provided us $25,000 in reimbursement, which doesn't even begin to cover our costs. So there's an issue. We're working through the state. This has been brought up the chain to DPH. More information coming from you. My hope would be if the town of Northborough can get the medical reimbursements, we can just pay the individual towns what you've extended because we got reimbursed for it. And because FEMA in Ashland was kicking them back to us. So I'm working through that. So just stay tuned.
I have to go.
What's
Bye,
up?
everybody. I'm
You
sorry,
gotta
I have to go.
Okay.
Take
All right,
care.
good seeing you, Jen.
Thank you.
So anyway, for all of you guys for Southborough and Boylston, stay tuned. We're trying to get to the bottom of that. And if we can get that funding,
I mean,
um,
Carla and Neil are looking into it, as you know.
okay, so we'll see where we shake out, but more to come on that. Okay. Okay, so I guess I got a lot of go to do. So thanks for all my direction, and we'll get Northborough to sign that contract and see if we can hire ourselves a nurse and an epi in a week. That would be my dream, but be patient. We'll do what we can, and we'll look forward to coming back with more information. Hopefully we've made some good progress. So happy Thanksgiving to everybody. Have a great time.
Thank you.